Good evening and welcome to the second Inside Government Show for the fall 2024 semester here today at Cayuga Community College. This is a show that's shown on Spectrum, on Verizon Fios, as well as ARMA, the Auburn Regional Media Access, and Win 89.1, the college's radio station. I'm your host, Guy Cosentino. We are delighted to have in the studio today the Director of Community Health Services for the Cayuga County Health Department, Dr. Cassandra Archer, who's been with us before, to give us an update on discussing COVID, RSV and flu vaccines, as well as other items that skip through my mind, such as Triple E, which is around in the general area, but not necessarily in Cayuga County, and measles being found in the water supply up in Oswego. Prior to this program, she sent me an excerpt of a newsletter called Your Local New York Epidemiologist, and which was fascinating to me, but I want to read a extract that will tell you all you need to know about what the next 30 minutes are like. And that is that keeping up with public health developments, both policy changes and health events, is like drinking from a fire hose these days. That is the direct reason we have Dr. Archer here. Welcome back.
Thank you.
So it is terrific to be here. You were going to bring some others with you. They're all at budget hearings, and you have the funner job. You have to be with me, which I'm not sure is going to be fun. But how part of this started is you and I were talking before the show started. I've heard little bits and pieces about COVID and about flu and worries for this year. So right now we are in October. Where are we in COVID numbers? We'll break out flu and RSV to separate conversations.
So COVID numbers over the last several months, since June, we've had 60 to 70 cases of COVID per lab reports. These are only lab reports that are submitted through a laboratory setting, not point of care testing done in a doctor's office where the test is right in front of you, and not self-testing. This is less than it was at the last year during that same time, though we have always had a little bit of a surge of COVID numbers throughout the summer.
Okay, and why is that?
That's not well understood. COVID doesn't follow influenza and RSV.
Which not dive, but they're lower.
They tend to be lower in the summer, spike in the late fall through the winter. So that is less.
So are you getting elevated numbers now that we're into the fall?
In September, we had 87 positive COVID as opposed to in August where we had 36. So we did see more last month.
On the health spectrum, if it's a doctor, not as anything else here, is elevated at that number where you're almost double or more than double, is that a worry? Certainly. Or is that normal because people are going inside?
Increased infections are a worry because increased infections could result in higher levels of hospitalization, higher levels of complications, including long COVID.
Okay. Don't want to get into the politics of what's going on in Washington, but there seems to be a little bit of confusion about who should get COVID shots, whether you're eligible, who's paying for them, and all that. So let's walk it through slowly. First of all, as far as you're concerned, you were a pediatrician. I used to go to your practice a while ago. Who, in your view, should get a COVID shot or a booster?
So I'm actually double boarded in both medicine and pediatrics. So when I was in practice, I cared for both adults and pediatrics.
I was not a pediatric patient of yours.
It is recommended that anyone over 6 months of age consider COVID vaccine to decrease their risk for infection, decrease their risk for spread to others within their household or family or social circle that may be at risk for increased severe disease.
And is everyone, and New York is among several states that there were some steps taken after some actions in Washington, if I was to go in, the college was nice enough to bring Wegmans in. We all got our flu and COVID shots if we wanted a month ago this week. If I want to go to Walgreens, Walmart, CVS and Skinny Atlas, I'm missing somebody in their Wegmans, who can give me the shot now?
At this point, anyone can So pharmacists can immunize anyone for COVID over the age of 3.
Okay.
And under the age of 3 would need to receive COVID vaccines from a provider.
And so on those 3 and above, let's talk about those, because that's 3 to, let's say, 93. I walk into Wegmans, am I charged to go there?
That would depend on your insurance.
Okay, so in some case, but I thought there was an exception in New York, because there were some questions that some of these larger chains, I do not think Wegmans was part of this, but some of these larger chains were questioning whether they were going to give them out in other states where there were prohibitions against them.
Before the CDC acting director had officially signed off on the...
Which one? No, sorry, I was going to say which director?
Not HHS. The
Okay.
acting CDC director had signed off on the Advisory Committee of Immunization Practices recommendation. There was some confusion as to whether a prescription would be required from a provider, which could present a barrier for those who might not have doctors.
Now.
That is not currently required. Anyone who is an immunized, able to immunize, which includes a pharmacist and a registered nurse or a provider, can perform shared decision making, meaning that here's the vaccine, here's the risks of the benefit, here's the risks of the vaccine, here's the benefit of the vaccine. I think the benefit is more than the risk and you should get it, and the person says, okay, fine.
I'm assuming somebody keeps the data, but I don't know if it's broken down in New York and New York by county. Do we know how many people get the vaccine?
I do not believe that dashboard is currently being maintained. We had that through
Prior to this.
through the emergency, but not.
Is it because we think COVID is not as serious a health issue anymore, or is it just policies change as time evolves?
It's likely capacity as to who's going to maintain that database.
You're still in the medical community, you still see people, whether it's through your office or at Wegmans or a restaurant. What are your fellow past providers telling you about the response they're getting from patients? Are they wanting to get the COVID shot, or are they not wanting to get the COVID shot?
Unfortunately, across the board for any immunization, we've seen more mistrust and denial of vaccines. I've spoken to people at the maternity floor at the hospital stating that parents are refusing the child's birth hepatitis B vaccine, which is one of the first vaccine that children receive. Long history of safety. People are refusing vitamin K, which is given at birth to decrease the risk of bleeding, because children don't have any vitamin K at birth.
And that's not clotting?
It's to prevent bleeding.
Bleeding, okay.
And that's not even a vaccine. So unfortunately, that's what we're seeing.
All right, so let's get off the COVID train for a second. Just on that particular, as somebody who saw patients, I don't know, I would walk on in a Monday and I would think you had 38 people in the waiting room. So you saw a lot of people in a week. How do you explain to them, and what is this distrust? You use the words denial and mistrust. How do you overcome that in the short term, and then I want to get to the long term?
In the short term, in the room with a patient, I would remind them that either they or one of their loved ones had something that could, because everybody does have something or someone they know that could be at increased risk for complication. Yeah, I would say, okay, you told me your daughter had, I saw your kid last week for an asthma exacerbation. If you get the flu at work and you bring it home to your baby, that baby might get sick again. So let's get you the flu shot so you don't make your baby sick. I get my flu shot. My kids get their flu shots every year. Sharing that information one-on-one is usually powerful and I think respected from patients. Unfortunately, we've turned into a not one-on-one society, and we're all just...
So I want to go back to that in reverse. So I have a 13-year-old now, but when he was younger, there was worry about whooping cough. And I know it's pertussis, is that what it is?
Pertussis.
Pertussis. So my dad, who is 93 now, but back then was 83, he got the shots because he wanted to be around his grandchild.
Yes.
And not that my wife would have said no, but I would have. Is that, are we even going to the point where grandparents and parents aren't even getting those shots when they should be getting them because of their children?
I mean, I think that some people are agreeable and some people hear that. I think I've also heard family turmoil where I'm not letting my mother see my kids because she won't get her COVID shot or she won't get her flu shot. And that's heartbreaking.
So that's the short term. Let me talk about the long term. What are the long-term consequences? You know, I'm not talking about a, germs, guns, and steel type book thesis right now, but what is the long-term health outlook, not only for Cayuga County and for Auburn and for Central New York and New York State, for this country if we're not getting people vaccinated? I mean, our history of vaccinations, as I understand it, goes back to as far as back as George Washington getting his troops vaccinated, the father of the country. So what's the long-term outlook if we're going not forward but resistance?
We will unfortunately see diseases that we have not seen in 50 years. We have already seen that with the measles outbreak nationwide and in Canada. We will see mumps again. We will see congenital rubella with babies being born with congenital heart disease from mothers who got infected with.
And do we get variants from that we don't have vaccines for yet?
Fortunately, those viruses are stable viruses. They don't mutate. So that's why the vaccines are so effective when we give them and receive them appropriately in childhood.
So is COVID and flu and RSV, are those ones that do mutate?
There's multiple variants and mutations of those types of viruses, yes.
Just a curiosity question on my part. Forget who's in what administration, but we've gone through and we've gone now through 3 or 4 years of COVID vaccines, and they all vary a little bit. How can they scope out 6 months from now? We know that's the strain we got to fight. How do they do that?
For influenza vaccines, that was kind of messed up this year. But they typically base it based on what is seen in the southern hemisphere, which they are a little bit ahead of us in that in regards to how their influenza virus circulates. COVID, they just keep an eye on what is predominant. They can't predict ahead, but
that is not to say that these vaccines are perfect. There will still be people who get the vaccine that may get COVID or the flu, correct?
That is correct. The vaccines...
But that's not reason enough not to get them.
Right. You can get an infection, which will hopefully be mild and not end you up in the hospital, and you won't spread it. The flu season last year through 24-25 was a very severe flu season. We had 280 pediatric deaths in the United States. That was the most in 15 years. And 90% of those children were not vaccinated.
So let's jump to flu. So there's flu and RSV. What are our numbers locally on that?
Currently, flu numbers and RSV numbers are low.
And what, for those who may not know, and I'm one of those, tell me the difference between flu and RSV.
So influenza is a virus. Respiratory syncytial virus, RSV, is another virus. Both of them tend to circulate through the same season, late October through March, March, April, May, June.
And when I get my flu shot, am I getting a shot for both RSV and flu?
No, RSV immunizations are they're separate immunizations. RSV immunizations are recommended for pregnant women who are at a certain gestational age during a certain season. And they are recommended for everybody over the age of 65 and over the age of 50 with certain medical conditions that might increase their risk for a serious complication associated with an RSV infection.
And so why should, I think it's the same answer, but I still need to ask the question, why should you get vaccinated for flu? Having a flu vaccine decreases your risk for hospitalization and death
even the years that our flu vaccine didn't match up well with what ended up circulating, you still have a lower risk of hospitalization and death if you receive an influenza vaccine.
And so I think I caught it, so maybe I'll pry at this or pull at this string. You indicated that the vaccine last year or this year was off, that it wasn't developed.
No, actually, we had a good match last year in regards to the severity of the season. It was also one of our lowest vaccine rates.
Okay, so is that tracked?
Yes, nationally.
Nationally.
Not
Okay, so
within-
these are not
yes.
local numbers here.
No.
Okay. So skipping all over the place, as I am apt to do, was watching Channel 9 or somewhere, and they mentioned that measles were detected in the wastewater in Oswego County.
Mm-hmm.
I believe both Oswego and Ithaca test their wastewater. But this goes to the broader issue that measles have been in the news for a little bit over the last year. Talk about what does the discovery of measles in wastewater mean?
That suggests that someone provided a sample to the wastewater with an active measles infection. There was no noted cases in Oswego County at that point, so either that individual was passing through or did not have a severe enough infection to seek medical care.
And have we had any measles cases in Cayuga County?
No, please
Okay.
don't jinx me.
Okay, so does Auburn test its wastewater for this?
So in regards to wastewater sampling, there are two organizations that do wastewater sampling. One is through New York State DOH, and the other is through a national company or national organization which is called Wastewater Scan. The measles report was through Wastewater Scan. And Oswego and I believe Tompkins County submit to that. Auburn submits to the DOH. That dashboard is also currently not functioning.
Because of federal funding or because it's just not functioning?
It's just they're trying to fix it, apparently. There's tech
Okay.
issues. But the way they decide as to whether they're going to test, what they're going to test wastewater for, specifically in regards to measles, is based on the vaccination rate. So Oswego County has a lower vaccination rate than we do, and that's why they were tested through that organization.
And do we know what Cayuga County's vaccination rate is?
Cayuga County's vaccination rate I meant to look this up, I'm sorry. I'm pretty sure under the age of 2, it's about 87%, and then over the age of 6, I think we get up to 95%, but I'm not entirely
So
sure on those numbers.
the under group where you had 87, my worry would be the 13%. So
Yes.
Are there worries, because there has been a lot of doubt cast upon measles from certain individuals in Washington? Are you worried that people are going to, especially new parents, not get the measles vaccinations?
Yes.
And please, I may have the wrong vaccination. Is this the one where they're now suggesting it be done in 2 parts versus 1?
So,
I don't want your head to explode as I'm asking you these questions.
so MMR is a vaccine that protects against measles, mumps, and rubella. There is another vaccine which is called MMRV, which protects against measles, mumps, rubella, and varicella. Children receive immunization for measles, mumps, rubella, and varicella. Varicella is chickenpox, sorry.
Okay.
At age 12 months and age 4 to 5.
Okay.
Because for years, parents have told pediatricians, why are you putting so many needles into my kid?
My kid would say, why are you putting so many needles into me?
Yes, once they start to talk, they say that. But
Okay.
your 12-month-old doesn't say that. It just screams. So there was a combination shot developed. The combination shot, when it is the MMRV, when that is given at 12 months, there is a very small, slightly higher risk of a febrile seizure. It sounds terrible. A febrile seizure is a small, brief seizure, which sounds terrible, but does not mean your child has a seizure disorder,
right,
and does not increase your child's risk for neurologic problems or anything along those lines. Because of that, when the vaccine schedule previous to this most recent one was developed, MMRV and MMR were both on there, though there was the option for the pediatrician to split them up.
Okay.
So that you didn't have it.
But now they are suggesting you split them up.
Now you cannot give MMRV at 12 months. You can only give MMR and V separately.
Okay, so the criticism of that, as I understand it, is that a parent might get the first one, but they may not come back for a whole host of scheduling, childcare. Yes. They read something.
Yes.
They may not come back for the second one, and what does that do to the person who does not get the second shot?
So if for example, you saw a child at 12 months and mom says, I don't want to do this, because keep in mind too, at 12 months the child is also receiving a pneumococcal shot and a hepatitis A shot. So that's 4 shots that we're doing at that point. So if the parent says, well, can't we split them up, do them one at a time, whatever, and then doesn't come back, the child is vulnerable until they return for those immunizations. So if they get their MMR shot and then the next day get exposed, or a couple weeks later get exposed to someone who has chickenpox, the child may develop chickenpox. I know you and I had chickenpox, but chickenpox prior to the vaccine used to hospitalize about 40,000 kids a year with chickenpox pneumonia, chickenpox brain infections, or bacterial infections of the sores.
So this goes to the whole issue that there's a lot of discussion right now about what is coming out of Washington when it comes to directive for vaccines. And so I guess my question, first of all, would be, when directions come from Washington, some are countermanded or are different from the state of New York, what does a county follow?
I think,
besides your judgment, because you...
So the issue is that, especially the county serves as a safety net for children who may not have insurance, children who may be on Medicaid, whose pediatricians or family practice doctors don't provide publicly funded shots for the vaccines for children. There's a very regimented hierarchy. The Vaccine for Children program is a federal program, which is administered by New York State. If the federal program doesn't provide the vaccines, it's not up to me.
Right. But what happens
where
if the
those
state...
kids going to get the vaccine?
So some states, I know there's a compact of Western states, have said, well, we're going to just go out and do it on our own.
So that comes more to what is the indications and the indications for the vaccine. So for example, when there was a period of time where there was unclear guidance from from the CDC as to who would get a COVID vaccine, the different professional organizations like the American Academy of Pediatricians, the American College of Obstetrics and Gynecology, the National Foundation of Immune Disease, all released guidelines to help guide physicians to have conversations with their patients about what vaccines would be recommended.
So you're a local health official. What does this debate about the efficacy of vaccinations that's going on in Washington and somewhat nationwide, where there are critics out there who just don't believe, what does that do to your job of trying to get people vaccinated?
I mean, as a pediatrician, as a mother, it's heartbreaking to struggle and try to figure out, am I going to be able to order COVID vaccines for all these people that I know need them, who should get them, but is it going to be covered by insurance? Is it going to be, are we going to be able to get the Vaccines for Children's program? It's been heartbreaking.
So let me throw one more hand grenade into the mix, and that's this whole discussion about Tylenol.
You didn't say we were going to talk about that one.
I did not say we were, well, because you said something that just reminded me of it. So when it comes to things like that, is that just, I'm not saying whether I am saying, not so much whether or not it is good or bad or whether it impacts pregnant women, but when there's not necessarily long-term science released on it, does that make it more difficult when you get a parent into a examining room?
What makes it more difficult is there is long-term science that, as I will say, is safe during pregnancy and does not increase the risk for autism, and that science is disregarded by those who don't have a science background but are empowered to make decisions.
All right, let me get you back onto track about are there other vaccinations out there that people should be getting, and to what degree out there locally? We talked about, you and I talked before, pneumonia. So tell me about, there's a pneumonia shot for those who apparently are of a certain age, which we might fall into. Is that something people should get, and why?
So pneumonia shots, what is called a pneumonia shot protects against a bacteria which is called pneumococcus. We give these immunizations to infants to protect them from pneumococcal infections. And then it's also recommended for adults, currently all adults over age 50, and anyone 19 to 50 who may have conditions that increase their risk for pneumococcal disease. Pneumococcal disease is not just pneumonia, it is blood infections and brain infections.
And what about what's commonly known as shingles?
Shingles is caused by the chickenpox virus. The chickenpox virus, after you recover from chickenpox, can go into a nerve root and sort of hide there, and then ultimately come back out and cause a rash. 1 in 3 people will develop shingles, and of those people, about 10% of people will have a severe case of shingles with pain that can last for up to a year, or it involves their eye and can lead to blindness.
And if you get the shingles vaccination, how do those numbers change?
So shingles vaccines are 90% effective at decreasing your risk for a severe case of shingles.
And what age group gets that?
That is also over the age of 50.
Okay, and anything else out there?
Everybody should be up to date with their tetanus / it's called Tdap, which also protects against tetanus and whooping cough. Everybody should make sure that they have had all other appropriate immunizations, especially if they're traveling, to include polio, measles, meningitis, certain areas.
And going back to the both COVID and flu, are there nasal, because I know some children are not very keen on shots, and I know the health department years ago used to have the nasal, and it's rare where you can find it at a pharmacy. Are there nasal vaccines for both flu and COVID?
There are only nasal immunizations for influenza vaccines. They are restricted to certain age ranges, and you can't have any underlying conditions like asthma or things along those lines. There's no nasal COVID vaccines.
Okay. I'll let you off the hook on EEE because we've run out of time.
Oh, really? Okay.
So in that case, there are no cases here.
There are no cases of EEE here.
But my last question to you is, what right now is your biggest health concern locally for Cayuga County?
My biggest health concern is the mistrust in the medical field and the public health field.
So tell them why they should go get vaccinated for whether it's flu, RSV, or COVID.
Nothing is without risk, but when you look at your risk for being exposed to a disease and having a serious complication versus your risk of a complication from vaccine, in general, you are always better off getting the vaccine. If you have any concerns, talk to your doctor, talk to your pharmacist, but please consider getting your influenza vaccine and your COVID vaccine this season.
I hope over the last half hour we've kind of lessened the speed of that fire hose that I talked about at the beginning with the local epidemiologist from New York who basically said all the information and changes out there. I thank you for the last half hour. I appreciate the health department always coming on and sharing your information about how people can stay well. And hopefully you'll be back in the studio soon about good things as well. Our guest has been Dr. Cassandra Archer from the Cayuga County Health Department. She's the Director of Community Health Services. We want to thank her for giving us this update. The colleges offer Assessment Day. That's an internal thing here at the college on Tuesday, so we won't have any shows. Our students are off for a 4-day weekend. They all went thumbs up here, but we will be back on the 16th with the first of 2 forums co-sponsored with the Citizen and the college. We'll have both candidates for the 10th Legislative District, which is a special election, facing off Democrat Amy Sargent, who is currently the incumbent in that position, and Republican Michael Pettigras. Robert Harding of the Citizen will be asking the questions. I will be moderating. We'll be back a week after that with the City Council. But if you would like to send us your ideas for questions or guests to have on, you can send them to cozguytho@aol.com. Those are for the guests to come in, not political questions. Those are for Robert Harding to come with. I'm Guy Cosentino for Cayuga Community College. We want to thank you for watching. Have a great long weekend if you're getting that. Otherwise, we will see you back here in the studio next Thursday on the 16th for the 10th Cayuga County Legislative District Forum.